segment on Bridge Street is sponsored by Aging Advocates CNY.
May is Aging Life Care Month, and that means now might be a great time to get to know some local aging life care professionals.
Melissa Murphy is a certified care manager and the founder of Aging Advocates CNY. Eileen Welch is the owner of Compassionate Care Management of CNY and is a licensed master social worker. They both join us now to talk about the work of aging life care professionals. Always great to see you. Thank you for coming on. And, Melissa, before we get any further, remind everyone of what your role is with Aging Advocates.
Sure. So we like to look at everyone's individual aging needs from a holistic manner, and we help identify what their needs are and how we can best help them meet their goals during that aging journey.
Awesome. And how about you, Eileen? Tell us a little bit about the work that you do.
Yeah, so I'm also an aging life care manager, and we do similar things. Excuse me.
I have the same thing. I don't know if it's allergies or what.
It might be.
I think so.
Yeah.
Can't talk today.
So being a social worker, I also do therapy in-home and via telehealth. But as an aging life care manager, helping connect people with resources and, like Melissa said, really a holistic view on helping people age well.
Can you talk about how you work together in this?
Yeah. So when did we meet? Several years ago.
Yeah, a couple years ago.
We are both part of the Aging Life Care Association. So I think I actually did find you on our website.
Yeah,
so you can actually go on aginglifecare.org, put in the zip code, and then the fellow aging life care professionals will come up in the area. So I saw Eileen and thought we should definitely connect. And we have very similar views as far as our values and what we take from the association. So do you want to talk a little bit about that? What we agreed on?
Yeah, for sure. So as part of the association, we're bound by a code of ethics and standards of practice. And one of the major components of that is that we don't take any money from any agencies or any facilities, no assisted livings, no referral fees or kickbacks or anything like that. So we are paid by our client, and we work for our client.
Yeah.
Interesting.
So always their best interest is our goal.
For people who are interested in finding a professional, is it often like the children, like I just said to you, I'm approaching 40 and my parents are in their 70s. Is it typically the children who are reaching out to find folks for their parents? Is it typically the seniors themselves who are reaching out? What do you see, and how do they find a professional?
Good question. Unfortunately, it's usually the family reaching out because there's some sort of a crisis happening. Okay. So a fall or a dementia diagnosis. We are trying to encourage the aging individuals to reach out themselves before they get to that point. There's so many interventions and goals that we can help them through that will prevent that crisis, so that the family doesn't have to be the one to reach out and then make it uncomfortable sometimes. That dynamic, the children and the parents, nobody wants to be in that position. So I think it is important to be proactive and find that aging life care professional in advance.
Right.
How is an aging life care professional different from like a case manager?
Good question.
Yeah, I think a case manager has a more specific focus. So like a case manager might be someone who is working in a hospital, trying to come up with a discharge plan, whereas an aging life care manager, again, that holistic view of things, really just trying to look at everything and trying to make sure that we're finding solutions to any issues related to aging.
Exactly. So we're looking at the individual's health needs, social needs, financial situation, family dynamic, finances. That's a huge piece of the puzzle. So when we have all that information together, we feel that we can do a better job helping them navigate. So that's where it's a little bit different than a crisis case manager in a hospital.
Well, ladies, we are out of time, but thank you so much for the work that you do and continue to do in our community. And for more information, you can head to aginglifecare.org and click on the Find an Aging Life Care Expert button at the top right of the screen. You can learn more about Aging Advocates online at agingadvocatescny.com. This segment is sponsored by Aging Advocates CNY.